On the first day of classes, we were asked to write down our personal definition of health. At first, I thought it would be easy, but I was wrong. I did, however, get a few points down. Able to perform daily tasks without trouble, good diet and exercise equals good health, immune system is working properly, but I have learned over the past few months that health goes much deeper than that. Health includes everything from health promotion and prevention to primary health care and the social determinants of health. Health promotion is about creating a healthy community. People within this community work together to create a healthy environment and have control over some factors that may affect their lives. The process for creating a healthy community is a continuous circle. It starts with addressing community strengths and issues. This step includes developing awareness and establishing stakeholders. The second step is commitment engagement. This includes planning, engaging the community, identifying conflicts, reaffirming priorities, and creating mutual strategic goals. The next step in this circle is community action. This step involves implementation of previous planning, engaging the stakeholders that were established, defining roles and tasks, and acknowledging conflict and affirming use of fair practice. The final step is reflection. In this step, the community reflects on lessons they have learned, shares knowledge, and plans any improvements that can be made. The circle then continues, going back to addressing community strengths and issues, and repeating until a healthy community is established. Health prevention has 3 levels: primary, secondary, and tertiary. Each level represents a different stage of health. Primary prevention is the promotion and protection of disease such as immunizations and safety and accident prevention. Secondary prevention represents the early detection of health problems, which therefore prompts intervention. Examples of this level include screening for diseases and annual examinations. Tertiary prevention is the restoration and rehabilitation back to optimal health. This would include things such as teaching foot care to diabetics and increasing range of motion. Another major component of health is primary health care. Primary health care differs from primary care in that it goes beyond just the healthcare sector and is more focused on the community. Primary health care values are achieving health for all, social justice, and equity in health. To uphold these values, primary health care has 5 principles: accessibility, public participation, health promotion, appropriate technology, and intersectoral cooperation. When defining health, I missed a pretty big aspect that makes up every person's individual health. They are called the social determinants of health. When you are thinking about a person's health, it is important to include all of these determinants. They include poverty, social status, stress and coping, power differentials, education, healthy childhood, race and culture, healthcare access, social support, housing and food security, gender inequality, employment, and social exclusion. All of these factors work together to affect a person's health. Because of these so-called determinants, 2 people with the same genes or health problems can have very different outcomes. When looking at everything that is included in our health, I can honestly say that my definition of health has changed drastically since the beginning of this course. I no longer think that, in order to be healthy, a person must be able to do day-to-day tasks with little help. I also now know that health isn't just about rehabilitation and restoration back to health when a person is sick. It is about preventing illness from occurring and reaching out to communities to promote healthy lifestyles.